for all our alumni. And not only alumni, but all seminars, activities. This is the great thing that ever happened in this campus, I want to tell you. So I'm proud of him, all his contributions. What I thought I can talk, I came here 2 years ago, 27th of February, which is almost a couple of days ago. And I talked about peptide-based discovery for diabetes and obesity. For the last year and a half, I changed the direction and going with the future of AI-based peptide discovery. So I can give you some flavor of what it is. But before that, I want to introduce two people. One is Professor Indira Kishan, a lot of people know him. My PhD thesis was an oral anti-diabetic agent, diabetes. And this is Dr. K.V. Maktoum, CDI, who taught me this peptide chemistry. And till today, I am doing a anti-diabetic drug using the peptide therapy. It's 40 years and it's still the same. Continuing, very few people have the opportunity to continue in the same area, therapeutic area, and also the peptide. So, Dr. Mathur, he is having a great time in a few days, 90th birthday. So I had just the opportunity to see him last week, and here's my acknowledgement to them. So, for students, peptides are just a small fragment of a big protein. That's what it is. So why peptides? I know we all talk about small molecules and everything. So peptides, because they come from the body, endogenous ligand. So because they are coming from endogenous ligand, they are very safe and they are very efficacious. And that's the reason peptide has a lot of market success there. So if you look at that, here's a graph. Out of 100 drugs that have been tested in human, 33% make it to success in peptide based. But if it is small molecule, only 30% drug make it to the phase 3. So you can see the success rate of the peptide is pretty almost twice than the small molecules. The small molecules like aspirin and Advil, those kind of things, man-made. And the protein-based are you modify the drugs that is inside your body. And if you look at that, roughly 120 peptide-based drugs are currently in market, and most of them came last decade, and almost 150 drugs that is coming, they're in different stages of the clinical trial. So if the success rate is about 33%, you're going to see next 30 days, next decade, you're going to see another 30 or 40 drugs in the market. So peptide is, like I said, it's very skyrocketing, and this is true. So don't need to worry about it making photocopy. If you're interested in slide, I will modify and give it to you in a PDF form, if any particular slide you're looking for it. So you can focus on it. And I've been really, like Priyanka mentioned, I've been a part of the several drugs that came from my own lab in the last 20 years. So this is first simile that I brought in 2004. This is for type 1 and type 2 diabetes. And basically what it does is just fluctuation in the glucose that you see in your body, it maintains the level all the day same. So this is a 10 microgram or 60 microgram dose. Then we bought Biota first in GLP-1 class. That you see GLP-1 class is the one drug you see in the ad, all that sometimes semaglutide and other things, right? So this is the Biota first time we bought in 2004, this drug in the market for type 2 diabetes. This is a 39 amino acid peptide, this is a 32 amino acid peptide. But this is given twice a day. So 2 times a day injection is painful. So we decided take this drug and reformulate in a different formulation like polymer, nanoparticle, those kind of things, and convert them into once in a week delivery. So you don't have to take twice a day injection, but take one injection a week and it's done. So we brought this drug in after four years or so. But once we brought this one, that has a 2 problems. A minor problem is when you take the injection, you get nausea. So first couple of days you feel vomiting or something, but then everything is fine. So we decided to convert this one into a non-nauseated drug. Back in GSK, we took the 30 amino acid peptide and make a dimer, like one attached to other one, and then put the PSA, big molecule, so make a fat, and then blood circulation slowly. So this is once in a week that we brought this drug. This one has no nausea and similar efficacy. Then we also brought this drug Mylepta, which is like a leptin, 144 amino acid peptide sequence, and we changed only one amino acid, just one amino acid, and called methionine, and it became metroleptin, dyslipidemia, because lipid metabolism changes. So we brought this drug in there. So these are all diabetes and metabolic syndrome. Then lately we started working on once in a year. So we take this GLP-1 analog, take this GLP-1 first in class, and then this one we reformulated in a way that it gives you once in a year. So you inject one time, and entire year you don't have to worry about taking medicine for diabetes and obesity. So this is currently, I talked to this medicine last time when I was here, but this one has a couple of challenges recently. One is the manufacturing that has been shorted out, and other thing is when you have inject for once in a year, we're trying to do once in a 6 months so that people come and check it out, and then again you do another 6 months. So we're waiting for FDA's challenge there. So these drugs all came in 20 years, from my lab, my own lab, chemistry, my team. And Eli Lilly and Novo Novartis, they learned from here, and they went to very, very high dose. We were talking about 20 microgram and 30 microgram dose, they went to 3 milligram dose. And they went for obesity. The reason is this drug that we have, Biota, if you have a sugar high, only then it will act. If your sugar level down, it doesn't do in your body. So it's kind of like a self-titration. So Lilly and Novo, they just went to very high dose because it doesn't do anything when you don't have sugar and reduces the body weight. So that's why you see a lot of news in there. So this is the traditional way of drug discovery. You can see that it took us about 40 years, almost 20 years to get this drug there. And in this age, AI is too long. So here's an example of traditional, before I go to AI. Traditionally what you do when you have a drug, you have a discovery phase from millions of compounds you start with. And then you screen, and then after that you go to the first milestone called IND, investigational drug application, that you test in a human. Then you have another milestone where FDA gets approval. And then you have a third where you get a commercialization. So you have 3 milestones here. So this is me back in early days. This drug Biota came from Gila Monster. And this Biota that came in Illinois was first in class. One thing I wanted to share with you, anytime when you do something new, you're going to see a lot of objection. Eli Lilly, Novo, everybody said that this will never be a drug because it comes from Gila Monster. Even our own company management, they said, no, we should not be doing this. But 4 or 5 of us said, no, we believe in this drug. And we keep working on it. And today, it's $85 billion market on this drug. So you can see that sometimes you believe it, but you want to do it, and just continue doing it. But to bring this one, it took about 9 to 12 years for one particular drug, $2 billion investment, and the whole process for long. So this is, we didn't have AI in those days, and that is a no-no for, like I said before. So what we could do, this group as a scientist, what we have, we control only this part. This takes 5 years. Because other thing is all regulatory and clinical, you don't have much of a control. Let the data speak or regulatory agency will tell you. The thing that you have a control on it, this 5-year period. And if you look at that, what you do basically, you identify the target, then it hits the lead, and then finally get the drug. And this is the chemistry part that you are doing. So if we can use AI to this 5-year period and bring it down to a matter of just a month or year, then we are in a good shape. So AI can give the speed, And then because of the bioinformatics, genomic, there's a lot of information out there that you can use that to speed up the whole process. Another important thing that you see, analysis of the quality data. So in this old fashion, you hit and try, you don't know what's going on until you get the data. But today, with AI, you have a very good quality data that you can believe in. So this is one thing. And then robust correlation of the artificial intelligence and the experimental data. That's what AI can do that for us. So about a year and a half, I said, let's try that and AI. But what happened in AI, there's two things I want to talk to you today. Why AI? And then what is the AI platform is, and how can you use to develop a medicine? And a case study, I'll talk about the case study of how AI can be used, right? So if you look at that here, so when I was in GSK, and I proposed, this is 5 or 8 years ago, that we should do AI-based drug discovery. And I got a slap on my face. No, this is just a buzzword. This is not going to go nowhere. This is not social media. And they said, no, we couldn't do it. But now, you can see 2012 to 20, number of roughly 20 or 30 companies are working on AI-based drug discovery. And every year, and these blue dot, these companies are being partnered with the big pharma. So they believe in it. And number of companies has been formed here. Last month in JP Morgan, if you are working in an AI-based company, they are giving you, 5 years ago, they were giving you less than $1 million to do the work, the startup money. Today, they are giving you $5 million to start the money. And the same thing goes here. So the point is that AI is reality now. Of course, it needs human intelligence, HI and AI, only then it really matters. But the problem is that small molecule people are doing it. Peptide, very few companies, like here Pepticon and other. So we started using AI-based drug discovery. And when we look at the AI, first we have to develop a platform. So we are trying to do two things. One, trying to hit the target that are outside the cell surface. And the other target that's inside the cell. So we're looking at both aspects of the drug discovery. So this is just to tell you that we're working on cancer, we're working on metabolic disease, and they're working on rheumatoid arthritis. In the cancer, we're doing only melanoma and colon cancer. And diabetes, of course, we're doing the diabetes and obesity strategy with some other companies. So this is just want to talk to you about a couple slides what AI is, so you can figure it out. So AI, initially, when we have no AI, what we have here is you design so many molecules, and then you stream them with the different cell lines, and then see if you find something from here to here. But AI is adding two components in the middle. And the way it happened, these two components in the middle, these three things. I don't know if you know that this Nobel Prize, 5 Nobel Prize was given this year, 3 in physics and 2 in chemistry. They all are AI based. So this is David Baker's lab, he got one of the Nobel Prize. So there's 3 things happen. One, the alpha fold. Alpha fold is where you can have the 3-dimensional structure of the protein. Before that, you have the sequence, and then you get this confirmation. Now you can have a confirmation, you get the sequence. That's the difference. This is the most important point. You heard a lot about this company, NVIDIA. So they develop a chip that can do computing power. Just think about it, 0.1 cents per peptide per today. 10 years ago, $10 per peptide per cent. That is a huge difference. In time, it takes you femtoseconds to run a peptide. In the old days, it takes hours to run that. So because of this company, NVIDIA, and then also physics-based method, this whole thing really is sparked up. This is what the technology came from. So with this, what happened, you maximize huge number of compounds to make, but at the same time, make a very small number of peptides, you make it in lab. So that's what it's about. So what we do here, and this is you need to explain you, there's a 3 thing here. One, you virtually make millions and millions compound, virtually, on a computer. And then this is the Rosetta and ML. These are the terminology. I don't want to go in detail because you may not apply, but you can see that these are the three different things: confirmation, machine learning, and then physics-based method. Those are the three things. And then here, once you design molecule, you make automated synthesis. In machine, just tell the sequence, it will make a peptide, and then run the screening, and then once the screening is run, it will feed back the data. So we have the three things: virtual screening, and then automated synthesis, and then this learning cycle, whole cycle, should be within 2 weeks. Right now we are doing about a month, but our goal is to do in 2 weeks. So you can think about it, in 2 weeks, you can, the entire cycle, which is used, if you look at an old fashion, you're talking about years, not months, to do this that we are doing in 2 weeks. So this is a very important slide. You should know that because this is going to apply for anything but you do AI. AI is just not AI, machine learning. Everybody thinks machine learning is AI. So what happens, AI has 4 components. Machine learning, where you do all the data that's out there, you use them to train your machine. So machine is learning based on what is out there. Then the physics-based is a thing where you don't have the data out there. But how you train your machine? When you don't have like a protein and peptide, there's not a lot of data in the public domain because most of big pharma is working on it. So you don't train them. So you do a physics-based method where you write a different bond angle, bond stretch, and all the different Ramachandran curve, those kind of things you do, and you basically generate the data that you train to the machine right here. Then you take these two and put in a neural network. Neural network is just pretty much like your brain. All over the connectivity dots connects all these things, so connects all the data together. This is also graph neural network. You heard a lot of word. And then fourth is more important, how you define mathematical equation, algorithm. So AI has these 4 components. And these 4 components been applied for biomarker, peptide design, automation, and drug-like molecule, and also diagnostic disease. We, in our company, focusing on de novo design and then peptide-based design and these things. So I'll talk about this, so just give an example, and then so you can see how this applies. So you heard this 20 amino acid, right? But there's so many amino acids that are modified version of that. They call non-canonical amino acids. That's the word, if you heard, that's what modified version. So we took 2,000 non-canonical amino acids. And so it's like anything you should do, you optimize, parameterize that. So we take this non-canonical amino acid, you see modification here, and then we try to get the confirmation here using Ramachandran, and these are the tools, Rosetta and all these tools. So we parameterize the amino acid first. It's like a building block. Then you put those building blocks back in a peptide sequence. Because we didn't have this thing, so a lot of people cannot do any amino peptide that does have a non-canonical nature. Once you put in there, then you put the simulation of this peptide right here in the sequence, and then you Rosetta, and these are simulation, this is OpenMI. So these are simulation method. So you have this amino acid, put in the string, like a necklace, and then try to simulate and make it minimum energy confirmation, which you heard all the time. So that's what you do basically in order to get the peptide. So this is an example, very important. So this is how we use all these platforms. So this is a beta-catenin inhibitor. So when you have a cancer, 1/3 of the, actually 70% of the cancers happen because of this particular beta-catenin protein. So what happens, this beta-catenin protein, when you have a cancer, it goes inside the cell. And when it goes inside the cell, it triggers a transcription factor, which is called TNF4. And that transcription factor kills your cell, healthy cell, and makes you a cancer cell. So if you inhibit, you prevent this beta-catenin protein not to let go, attached to the TCF4, then your cancer cell will not be converted into cancer. So it's very simple. So we started almost 57,000 peptides after 16 amino acid sequence. This, if you understand the binding potential, this is very, very low binding. And we did all the cycle that I just talked about it. We did entire cycle, virtual metagenesis, Rosetta energy, physics. Hysteresis is just basically trying to do an error calculation. And then you apply a human intelligence. It's called medchem intuition. So the reason you apply medchem intuition because a lot of non-canonical amino acids, they're not available in the market. So you have to make them. And if you have to make them, they're kind of like you don't want to use them because it's going to take a longer time. So we try to filter out those amino acids that are out. So you look at that, 57,000 peptide, we bring down the AG2, 140, and at the end, 30, we make only 30 peptide in the lab. Virtually 57 and only 30. Out of this 30 peptide, we got a drug that is 5 nanomolar, which is very, very, you bind, when you have a peptide, you bind with the protein, tighter it is, lower the number. Because when they tightly bound, it's not going to come out, right? So that way, lower the number, better it is. It's a simple matter. So you can see everything, including the making of peptide. I'm not talking just the screening. Took only 4 weeks. Same thing, similar thing. When I was doing a GSK, sometimes it took more than a year. More than a year. And still, we never going to get the 5 nanomolar binder. We normally get 100 molar or something micromolar. So this is not the speed, but it's also the quality of the data that you get. That's the power of AI that's going. And think about it, if you do 4 weeks like this, you will have so many drugs in parallel very fast. So here is the same thing. You can see 5 nanomolar. We took this molecule and went back to the same cycle again. The one I was talking about, it takes 2 weeks. Here it takes 1 month because we're not there in 2 weeks, but that's our goal. And then we did another one, and look at that. 250 picomolar. This is almost 75% much better than by second cycle. And this is very, very tough. Picomolar means lower the concentration, lower the dose. Just think about it, if you take a 1 ml injection versus 0.00 ml injection, which you will prefer? 1 ml the liquid or 0.01 ml liquid? That's the beauty of this process. Now, but here when I said that this molecule has to go inside the cell, and then it's going to kill the cell, right? The instant DNA. We are not there yet. So what we're doing is, we're trying to understand cell permeability and solubility and cell killing. So those are the things we're trying to understand that how to do it. But we took this compound and put this modified, just like we do all the chemical modifications. We did chemical modification and you got inside the cell very further down. So this is the way you get the drug inside the cell and you kill that. But we did this in a traditional, old traditional manner, not like AI. So what we decided, let's figure it out how to do AI-based cell permeability. So this is a cell. It's like a circle. You have to get the drug inside, cross this membrane to get it here. If drug doesn't get here, you're not going to kill the cell, the cancer cell. So this is what we do. We take this whole cell line and simulate virtually, make a virtual cell line. And then we put the peptide to, let's put this way. So we make a virtual cell line right here. This whole thing, we convert into virtual, just like that. And we have 3 different kind of a molecular AI-based simulation. What it is, you take the peptide outside the cell membrane. Then you take the peptide inside the cell membrane. Then take the peptide outside the cell membrane and do simulation. So what happens is, when you have a peptide goes inside this middle, then some peptide stick on the top, and some peptide stick in the middle, and some peptide comes out of the cell wall. So basically what we're trying to do, we're putting the drug here, it's stuck here, then the middle, then bring it in here. So 3 stages. So we developed this model, and with this model you can do another thousands and thousands peptide screen, and it will not change. It can do virtually, you don't have to do experimentally. So here is the result. So we took a set of 100 peptides and pass through this virtual spinning. And you can see, this is just a validation of method, focus on this side. So if you see that, we have score 1 to 4. The peptide that shows in blue and the peptide that shows in orange, these are a highly permeable, means they go inside the cell and goes in the nucleus. These side of the peptide, they go, but they don't go inside the nucleus. So that means they are not good. We need to further refine those molecules. And here's example, it tells you which amino acid. So this is phospholipid. If you look at this one chemically, this is a head and this is the tail. So what happens when peptide goes in there, some amino acid is stuck right here, like on the top, some amino acid is stuck right in the middle. So what we're trying to figure it out, which amino acid in that peptide sequence is stuck where, then you can modify. So you can see that in this one, position 2, 13, and 15, those are small bar, like a smaller bar. These is stuck right here. So we go back and modify those amino acids so it can get back to the out of the cell wall. And this molecule, like here, position, this is I intentionally block the sequence. Attorney, that's what they do all the time. So here we look position 2 here and 14. These are stuck right here. So if we modify these, then you have all the drug goes inside the cell and it kills the cell. That's the whole purpose. And you can see that this is the result. This is 278 and then all the way, a very good cell permeability. This is done experimentally. That was all virtually, and this is done experimentally. So that's the way you get the drug that are inside the cell. You treat the medicine, treat any disease that requires the drug to go inside the cell. And that's what you can see. We are still working on it, not there, it's only a year and a half work that we are working on it. So second example, case study, I want to show you, you heard a lot about GLP-1, glucagon, obesity drug, and a weight loss drug, and a TV commercial as semaglutide. So this is, we look at that as well. So this one here, this is 39 amino acid sequence, and it binds on 2 receptors, glucagon and the GLP-1, glucagon-like. So just think about it like that. So this is what has been done from another group, where they took all the peptides that are in the literature, GLP-1, and they subjected to a machine learning, the single point mutation, and the neural network, and they got, if you look at this here, where you have a predictive value of one receptor and predictive value of another receptor. So when you have the predictive value, which is pretty good, but it's so messy. This is not good. So they did the second run, and the second run, same thing. You can see this histogram, much cleaner than here. And then they make certain peptide. And those peptides, you can see right here. So this is a model predicted. So lower the number, better the drug. Very simple. So if you look at that, this drug here, this is a model predicted. We call PC50. So you can see this is minus 12. Minus 12 is better. This is experimentally driven. Same drug, but they test experimentally, and you can see most of them are matching very well. So this is a very good way of seeing it, but there's a problem here. Problem is this, that they were looking at dual action, means a drug that binds into 2 receptors. In reality, they have some yellow, which is a dual, but there's a blue that is a selective. So that's not really a good thing. So if you're looking to drug to bind in 2 different receptors, then you should get a drug that should bind into 2 receptors, not the drug that binds into only one in the blue that you see. So this is okay, but not good. What we did here, different. So we started more than 100 data points, and this is very important part that I want to mention to you. This is the real meat of the AI. So what we do here, there are 3 layers. 1, 2, 3. First layer, you take all the data and assemble. It's like you have tons of beads and bring all the beads together and put in a single string if you want to make a necklace, right? Then in the second layer, you define a three-dimensional angle of the bead necklace. Just think about you building a necklace with the protein, and then you define the shape. You want a long or short or necklace. You want to put whatever the ornament you're trying to figure it out. So this happens here. And the third layer, where you put the biological properties that you want to have one receptor or two receptor or both receptor or whatever. So that's where you put there. So this is called three-dimensional machine learning, or you can also look at neural network, NN, that you normally see. So from here, we got 100 peptides that is good looking. Then you take 100 peptides and move into another physics-based method. And then you minimize only 11 peptides. Think about it, we start with the 100 peptide, or 100 or 1,000 actually, and then you're making only 11 peptide in your lab, experimentally. Out of 11, 9 were very, very potent. 9 were real drugs. And the other 2, maybe the quality control issue, we need to check that out. So here is the real outcome. If you look at this drug that we're looking at, it binds in a glucagon-like receptor, 12, which is very high, minus 12, used to be 8 or 9, which is original molecule. So you can see very tightly bound. Higher the number here, better it is, because this is a p-lab value. This one, remember the first mentioned the dual action. Here, million times more potent. Million times dead are the glucagon. That means this is a very, very selective. Because we were looking at the selective molecule, get that. And it gets solubility is 1 milligram per ml. Solubility is very important. Like for example, if you have a very, very high soluble molecule, then your injection volume is very small. And it's easy, it's painless when you inject. But if the solubility is low, then you get a 3 ml of injection. And that means you go to the doctor's office, it's going to take long time to inject. So higher the solubility, lower the injection volume, lower the injection volume, lower the pain. It's very simple. So very high solubility here. And this is the stability. Stability is when you have a drug in your body, it breaks down quickly. Longer it stays in your body, then you have low frequency of dose. You don't have to get frequency to get drug longer there. So look at this one. In 48 hours, this drug remains almost 97%. That means if you take this number and convert that is 60 days. This is half-life is 60 days. So that means this drug you can take easily once in 6 months or once in 3 months. So that's the way you expand your longevity. And this is all part of AI. Everything is done matter of weeks, not matter of months. Or may say years. It's done by weeks, not years. So that's the power of AI. That we have given you 2 examples to illustrate why AI-based drug discovery is happening now. And what it is basically quality. You have seen the quality data, efficacy, speed, and the cost. That's what you're getting AI-based. So there's a lot more to do. We are not there yet because only a year and a half and AI is just coming up. Just wait for 5 years, 3 more years. You will punch the information, kind of drug you're looking, and you will get the AI will tell you, this is the drug, go and make it, you're done. You tell the properties, I want once in a year to give a drug, I want this drug to cure 10% within a first injection, you don't want to have a half-life this. You put all the parameters what you're looking at the drug and feed there, boom, you will have a much drug faster. That's our goal. But we're not there. It's going to take long. This is a speech is there. And this is because multi-omic means proteomic, genomic, all this information is very helpful. You can do personalized peptide therapeutics, means every individual, even a cancer, every individual is different. And one drug will work on one individual, the other one does not. So you can do personalized treatment because of the AI is much faster. You can do. And this is the thing that we still need to do in order to make it very successful. So this is the feature of the drug discovery. In the AI, and you can do it faster. With that, if you are interested in peptides, it's a very hot topic. If you are a peptide chemist, people who come in the door and take you for a job. This is the situation right now. They just want to know, do you know peptide, how to do peptide? And it's very hard market right now in terms of the job, in terms of the drug discovery, in terms of the raising money. It's pretty hard. So learning peptide is very challenging because it's very specialized area. This is 6 books. It's been done in the last 10 years. Every 2, it takes, one book takes about 2 years to put together. I put together 6 books. This is coming in July. So this one, how you discover a medicine. This one, how you do medicinal chemistry, like a modification. This one, how you develop a drug. This one, how you manufacture a drug. This one, how you deliver a drug. Once in a year you plan. And this is radiopharma. Radiopharma is another area that we can talk some other time where you're hitting a surgical strike to the cancer cell only and killing the DNA just right in the middle, cut it, both the strain. So you, and the next cell that is healthy cell next to cancer cell, never going to touch. This is called surgical strike to the cancer cell only by radionuclide, and this is the book is all about that. It's going to come in June 4th. So if anybody wants to really build your career, this is the 6 books that is coming there. But to start with, this is the best one. They're all on Amazon, in every store basically it's available. I thought I can bring a couple of books, but it was too heavy. It says 25 kilo weight limit, and I said, there's too many things to carry on. But if anybody's interested in it, I'm happy to give you an electronic copy. Any particular chapter you're interested in, I will be happy to share that with you. As you all know, scientists are crazy. They need to have some hobby to de-stress. This is what I do. I fly a plane. That's my hobby. And I'm a 2-time champion for ballroom dance. And my goal is to get world championship in this July. And last year I missed it, but I'm working hard to get this year world championship in July. So this is what I do for fun. And with that, thank you everyone for happy to answer questions.